everyone, welcome to the She Speaks Her Journey. Today, we have Tengku Natasha Eleena with us, who is a dentist serving with the Angkatan Tentera Malaysia for 2 years now. Natasha is married and she has a beautiful 9-month-old baby girl. She's actively educating on dental health via her social media and loves to share her ideas and passion on parenting, gardening, cooking, baking and art. We are also glad that she's able to join us today to share her amazing experience of her birth story to inspire and to empower every woman out there. So Natasha, tell us from the beginning, what happened when you knew that you were pregnant?
Okay, hi doctor, hi everyone. So today I will share my journey, my pregnancy journey. Okay, so basically we got the baby after 2 years of marriage. We didn't plan at first. I think almost 2 years of marriage, I think my period came late. I think my period came late about 4 days because I monitor my period using the apps. Then when it comes to already a week, I started to get really scared, and then it was lunch hour. It was working day. It was lunch hour. I go to the nearest pharmacy and get the most accurate pregnancy test to see if positive or negative, and you know the result came out as positive. And then I went back home. I was not sure, so. Actually, I didn't surprise my husband because I didn't, because I was so scared. I was so scared the pregnancy test is faulty, or so I asked him to buy another pregnancy test.
Oh, but you told him to buy another test.
Yes, I asked him to buy another one better than the one that I bought. And then he bought the most expensive one at the pharmacy, and then I checked, and yes, it's positive. But then we kept secret from our family. We kept secret until I was nearly second trimester, nearly 4 months, and I went to the clinic also to get scanned. Usually, it was I think 5 weeks of pregnancy. Usually, they don't do the scan because it's still early, and then they said it cannot be seen under the scan. But I said I want to be sure, and also I did the urine test also, so both came out positive, and the scan that's sac, yeah, so it's positive that I'm pregnant.
So both you and your husband, you all were excited to embark into this new journey?
Okay, honestly, because we didn't plan, and also because I was sitting for the exam and I was in the middle of doing my research, so it was a mixed feeling for both of us. And he just completed his housemanship, but at the same time we both are excited, and then we planned that we have to keep the secret because it's the first baby, my first pregnancy, and I'm afraid if there's anything happen, you know what I'm saying. So we wait until 4 months, then we surprise the family.
Okay, so were your family really excited because maybe is this the first grandchild in both the families?
Only my family. Not his family. His family already got 2 grandchild. And we broke the secret because his family is going for Umrah. And then we have to tell them before they are going there. And also, I told them before I went for clinic checkup, because it was already 2 years. So his mom assuming that, oh, you guys want to go for fertility checkup, is it? For fertility, and then I was like, no, because I told her I want to go for maternity clinic, so she assumed it was for fertility. So I said, no. Then I told his mother, actually I'm pregnant. But then and then his mother cried and all. But then I told her mother, please don't tell anyone yet. I go for checkup, I go for scan and all. I confirm first, then I let you guys know.
That was interesting. So I also know that your 9 months journey, it has been very smooth. But however, during the end, it was a breech. That means the baby's bottom was coming first in your womb. So would you want to share what happened at that time?
I went for the checkup every month, and towards I think about 8 months. Towards 8 months, they did the scan. And they said that my baby looks breech, appeared to be breech, which is the head is bottom, at the bottom. I'm sorry, the head is upwards. So they said, but it's okay. Let the baby swim first because it's 8 months, and wait until it is 36 weeks, which is 9 months. If during the 9 months the baby is still upwards, her legs is still downwards, so they will refer me to the specialist, because they said at 8 months the baby still can swim, still can turn. So they said it's too early for them to refer me to the specialist.
Okay, so you waited, and then at 36 weeks, was the baby's bottom still coming first?
Still not. Still not. I told my parents, and my parents told me to go for massage and all, but then I said, I think that's not safe. I just wait for the specialist. I wait for the next scan, because during the 8 months, it was like once in a month, if I'm not mistaken, once in a month scan, right? Once in a month scan. So I wait for 9 months, and it was still breech. It was still a breech baby. So they sent me to the specialist, to the hospital, and they did the scan and all. And then they asked me if I just want to let the baby in that position, or I want the baby, or I want them to help to turn the baby so that the head is at the bottom. So I asked them, what's the difference? What's the complication of the breech baby? And they said if the baby is breech, is that position, there's a risk of I'm not going to go through the normal delivery. So of course, this is my first pregnancy, and as a mother to be, and as a woman, I want it to be normal delivery. Am I right? So I said, okay, I will try the whatever method the specialist will offer to me, so that the baby can turn to the position that it should be.
So some women will choose not to go through the procedure to turn the baby because they have certain fears that the procedure might hurt them or hurt their baby. What are your thoughts about this?
Well, for me, it's their right. Okay, of course. But for me, if you want it to be normal delivery, then go for it. Go for the specialist. What specialist will offer to you. But if you choose to get cut, to go through the caesarean, to go for surgery, then okay. And of course, my mom said, go for massage, go for tukang urut. Okay, she said go for tukang urut, but because perhaps they can help. And then I told my mom, as a medical professional, I said I trust the doctor more. What more is specialist, right? And it's free. What more is specialist? So I have to choose someone that is more qualified and safer, under the safe environment.
Okay, I think you made the best decision for your baby by going through the ECV.
I went through the ECV, the one that you mentioned, the ECV twice, because the first time they did, and it was very painful for me to bear. I was like, I cannot take it anymore. I said, because I told them I think I went through about an hour, because before the ECV they monitor me about 30 minutes, the baby movement, the heart rate. That is why I believe in hospital environment more than tukang urut. So I feel very safe, but somehow it was very painful, and I told them I want to stop. Okay, then they asked me again, so do you want to try again, or you just want us to book appointment for the caesarean. And then I called my husband, and then my husband said, it's up to you whether you want to be cut or normal delivery. It's up to you. He didn't force me, but my mom said, try again. Okay, so I went through the second time. Again, it was still painful, very painful. Then I gave up. I told them, just book for me for caesarean. So they booked caesarean for me.
We also know that you have been booked for the elective caesarean section. Would you mind to share what happened during your delivery?
Okay, suppose I was going through the caesarean at 39 weeks, but then by then my water broke at 38 weeks. I will not prepare. It was in the morning at 4 a.m. I still remember it was at 4 a.m. the water broke, and I quickly told my husband that I think I'm going to deliver soon. So he brought me to the hospital. I was in pain, but I have to be really patient. They have to ask me if I got any history of traveling. I got any symptom of flu, cough, and all. It was difficult after the delivery because it was COVID-19. So no one can visit me, including my husband. So I was alone, and I have to handle my baby all by myself. And also my husband also cannot go into the OT, into the operation theatre room. But then because he know the specialist there, so they gave him just I think about some minute to give azan to the baby, and then that's all. And you were just got cut and also just operated, but suddenly you have to do everything for your baby. So it's quite hard for me. But then thankfully, and I was very grateful that the doctor and also the nurse, all the medical staff is very helpful, and they helped me, and they give me all the attention that I needed.
That was really beautiful. Do you have any tips or advice to the mummies out there regarding what you have gone through and how you can help them so that they can be empowered to face their pregnancy?
Nowadays it's COVID pandemic, right? For the first time mother, I truly support them. But then for my friends who plan to get another baby, honestly, I told them to be really strong because the situation during this pandemic, and also the moment that your family and your husband cannot come and visit you, it was quite hard because you were very tired. And then you cannot see your loved ones and your baby, and you have to do everything on your own. So you have to be really strong, and also you have to be really mentally prepared, not just physically and mentally prepared. So yes, you have to be mentally strong during this COVID-19, and please stay safe. Please, if your doctor advise you to take the vaccine, I really recommend you to take it. Also after the delivery, if you want your baby and you yourself safe and people around you safe, please stay safe and do whatever it has been advised to do so.
That's a great advice to all pregnant women out there. So that was a really beautiful and wonderful journey. Thank you for sharing. Women's birth and experience can empower or scar them for life. We hope that through this, it will give strength to many and more women will start sharing their experience. So thank you, Natasha. I'm Dr. Catherine, your OBGYN.